Safety of imaging techniques in pregnancy. Ultrasound is the most commonly used imaging technique in pregnancy and is very safe, and it uses only sound waves instead of ionizing radiation. When we keep output limits as low as possible, fetal adverse effects are very minimal or almost nil, and there has been no proven effects of any fetal harmful effects. It produces a very mild elevation in the tissue temperature, but even then the obstetric probes, which are all calibrated to give a very minimal rise in temperature when you use an obstetric probe. Doppler and color Doppler do produce a little higher temperature elevation of the tissues, but even then these do not cause much fetal harmful effects. MRI has an advantage over ultrasound in certain conditions in pregnancy like acute appendicitis or to assess placental abnormalities, because it gives a clearer picture of deep-seated soft tissues. This also do not have any ionizing radiation, so it does not have any harmful effects, and even the acoustic output levels are all minimal and do not cause any proven adverse effects. Only thing is you should not use contrast, which is most commonly used is gadolinium contrast, especially because it goes into the fetal amniotic fluid and then it also goes into the fetal circulation, and it is better to be avoided unless it's really indicated for some reasons where you need to assess the nervous system of the pregnant woman for some medical reasons. Ionizing radiation, especially X-rays. X-rays are usually inadvertently taken like when you meet up with a trauma or you have some medical condition requisiting an X-ray, but you do not know that you have been pregnant. But you need not worry about it because the exposure associated with X-ray is very minimal. The levels of X-ray exposure needed to cause any abortion or skeletal abnormalities or any other abnormalities in the fetus is very high, and any of the diagnostic X-ray procedures do not involve that much radiation exposure. Considering CT, which is the most commonly used imaging tool, MRI is always better than CT, but when needed, CT can still be used. There are a lot of techniques to minimize the exposure. For example, a common pelvic CT causes a radiation exposure of about 50 milligray, which is very high, but still by using certain techniques can be brought to as much as low as 2.5 milligray. Contrast used in CTs are again iodine contrast. These are also present in the fetal circulation, and as much as possible it is to be avoided. But when the benefit of this procedure is very important in considering the maternal health, it is to be done. Next imaging technique which I use very rarely are nuclear medicine imaging. These usually tag a chemical with a radioisotope and is mainly used to assess an organ function. It is mainly used in suspected cases of pulmonary embolism where the scan called ventilation perfusion scanning is done. But in these cases, it's preferable to do a CT pulmonary angiogram, preferably as against ventilation perfusion scanning. But even then, when you use a nuclear medicine scanning also, the most commonly used isotope is technetium-99. Even when using these, the radiation is very low as possible. It can be as low as 10 milligray, which do not cause much fetal adverse effects, but better to be avoided unless it is really indicated. When contrast CTs or contrast MRIs are performed in a breastfeeding woman, the contrast do enter the breast milk. You need not avoid breastfeeding for this reason because very small amount, very negligible amount enters the baby's body via the gut.